Muted my.
All right, hello everybody, and welcome to the 2023 to 2024 Humankind series. My name is Megan Sponhauer. I teach in the nursing department at West Shore Community College, and I have the pleasure of hosting today's event. Today's event is titled Disparities in Maternal and Infant Healthcare, a panel discussion. So if you're not familiar, Humankind is West Shore Community College's cultural arts and lecture series. This series includes events like today's panel focusing on a specific topic. In the past, we've also had lectures by outside speakers. We've had musical performances, art exhibits, and we've even shown feature films. This is the 7th year for the Humankind series, and this year we are focusing on the theme of inclusion. So for our event today, we are delving into the field of healthcare specifically, and we're wondering, what are the barriers to healthcare for women in our area? What disparities do we see to childbearing women and for their babies, and what is being done to address some of these concerns in our area. So our panelists today are going to share with us their knowledge and experience specific to what I wanted to give you just a couple of facts to consider as we start the event. So first of all, according to findings in 2019 by the Michigan Department of Health and Human Services, in our state, infant mortality rates and preterm births are the highest among babies born to Black and Hispanic mothers and to mothers who depend on Medicaid for healthcare. So this suggests that race and socioeconomic status might play a role in access to care and outcomes for these patients. Another 2023 report by the March of Dimes looks at access to maternity care and showed that women of Black and other minority ethnicities, as well as those who live in rural areas, are being impacted by provider shortages as well. So 1.4% of babies born in Michigan were born into what we actually consider to be maternity care deserts. So for today's event, we have a panel discussion. I have 4 panelists here with us today. They're all experts in the field of maternal and infant health care, and they're going to share with us their perspectives on this topic. So I'm going to briefly introduce them to you now before we get started. So first we have Dr. Bethany Brown. Dr. Brown, she's one of our associate professors of nursing here at West Shore Community College. She teaches our obstetrics and pediatrics course, as well as our mental health course. She's a women's health nurse practitioner, a nurse midwife, and also a certified doula. Prior to joining us here at West Shore, Dr. Brown served as a nurse midwife and sexual health counselor and educator for the Michigan Department of Health. I also have Kelly Olson here with us today. So Kelly Olson, she's a licensed medical social worker, and she's the program manager for the Maternal Infant Health Program at Muskegon Family Care. The Maternal Infant Health Program is a free home visitation program for Medicaid-eligible pregnant moms and their infants. So Kelly is going to share with us how this program works and its impact on moms and babies in West Michigan. So welcome to Kelly. I also have Kimberly Sims here with us. Kimberly is the doula coordinator for an organization called How You Birth, which is in Muskegon County. So How You Birth is an initiative that was started by a group of women in Muskegon County in direct response to concerns about health disparities and infant mortality rates for babies of color. How You Birth is working to expand their services across Muskegon County, particularly for women of color, and I am super excited to hear Kimberly share more with us about this today. So welcome to Kimberly. And then I also have Patrice Beaubier here with us today. Patrice is a licensed and certified professional midwife, and she's the owner and lead midwife at Full Circle Midwifery in Oceana County. So along with her associate midwives, Patrice provides care for women who are delivering at home. She includes prenatal and postpartum services, and although many of her patients are in the rural areas, she also cares for patients of all demographics across West Michigan. So I'm interested to hear what she has to share with us about disparities in maternal and infant care from her perspective. So welcome to Patrice as well. So the format today is that each of our panelists will provide a short presentation for about 10 or 15 minutes each, and that's going to leave us some time at the end for questions and answers. So I would highly encourage you to ask questions while we have the panelists here. You can type those questions in the Q&A box at the bottom of your screen, and I'll be monitoring these, keeping track of those, and we'll share them with the panelists during the last portion of the event today. So I would also like everyone to know that we are recording the event today. It will be available on the Humankind webpage if you would like to review any of this information afterwards. So with that, I'm going to go ahead and get us started. So our first presenter today is going to be Dr. Bethany Brown from here at West Shore Community College. So welcome, Dr. Brown.
Hey everybody. I think I'll start with just kind of giving you a rundown of my interesting career that I've had. And pretty much it's all revolved around the health disparities. And a lot of it has been around maternal infant care as well. So I started as a labor and delivery nurse in 1999. I probably shouldn't say that out loud, in Muskegon. I was born and raised in Muskegon Heights, Michigan. I went off to the University of Michigan and finished my master's degree, my bachelor's and master's degree in nurse midwifery, where I started Muskegon General Hospital at the time's first nurse midwifery practice. That later grew into Muskegon Family Care, where I ran a 4 panel of nurse midwives and a physician for about 10 years. We grew a pretty substantially great practice. We had centering pregnancy, which is group prenatal care, which created pretty phenomenal statistics in the community and was well needed. Unfortunately, with some changes in the healthcare system in that area, those practices have dissolved. And in that process, I then got my doctor's degree and moved on to teach at MSU and then Central and Ferris and a couple other places, while also providing prenatal teaching and care in Haiti. So I have spent the majority of my career providing care for people in areas with high need. Most of my patients were uninsured, undocumented, or on Medicaid. In Muskegon, most of my patients were African American, and definitely in Haiti. And then when I moved away from Muskegon and practicing, I ended up in more rural communities, which has their own set of unique and hard barriers as well. I'm super passionate about all those things. My career focus now is to try to really create a space in the heart of new healthcare providers for these issues. It's been an interesting ride. I think when we think about these disparities, they really kind of are upsetting. I start my classes showing the video where we are the worst in health statistics, especially in maternal mortality in all of the industrialized nations. And it's people like some of the people you're going to meet on the panel today that are kind of rethinking how we can deliver care and what that can look like outside of all the barriers of big medicine. That's really going to start making some of these differences. I started as a doula, and it took me about 6 months as a volunteer doula at Muskegon Special Delivery to realize that I wanted to go into midwifery and provide services for care. And basically, they would call me in for the young teenage mom that didn't have any real support, or someone who they suspected didn't have the best family dynamics to sit with. So, I mean, the doula services, I'm so excited about. Muskegon needs them so much. I would love to bring back midwifery care and centering, which was huge. Centering pregnancy is where pregnant women meet in groups, and they're around the same gestational age. And we facilitate the discussion. We provide a lot of prenatal education, but basically facilitate their needs. And some of the best stories I can tell you came out of us doing that in Muskegon. A very basic example was a particular person came in late to the group, and we bring up, like, how are you going to get to the hospital? Who's going to bring you here? Because transportation tends to be an issue. And she said, I'll just call the ambulance. And we don't have to say anything, because one girl's like, girl, don't call the ambulance. That's crazy. And she's like, oh, here's my number. And then they got a piece of paper out and they all shared their phone numbers. And I kid you not, I made it to 4 of that group's births. And there was at least 2 other girls from the group at each individual group's birth. So super powerful, definitely needed, and just ways to rethink and redesign. But really, until we can really start supporting each other in our different initiatives for that, I don't know how we're going to make a difference. So I really, like I said, I'm trying to impart now in these new students a heart for that, because they're going to get kind of hit with some barriers in the typical healthcare system as it is designed today. But there are some people doing some pretty incredible things. But I want you to really consider, like, for the African American infant mortality statistic is just not, it's not okay in many realms. And we have to not only promote people who are of that community to come and become healthcare providers, etc., but we really need to listen to their voices. I wouldn't be uncommon for me to go walk to someone's house in downtown Muskegon Heights to get their 24-hour urine because they didn't have transportation. And I got a lot of flack for that. But again, until we're finding ways to meet these barriers, we are not helping, and we are sometimes providing very judgmental care. And I hope that we can create a space and a heart to change some of those dynamics. I think these students, I teach at MSU in the med school as well. They're OB, the incoming residents, the OB course, their first OB course, and they come with a lot of compassion too. And I always kind of preference it. Don't let the system beat you down. Please keep that compassion. Write yourself a letter today and see what that looks like 5 years from now when you're feeling kind of beat up. But yes, there are some beautiful things, but we really need to invite to the table those that this concerns. We really need to listen to the voices, and we really need to be respective of what the priorities are and provide care in those realms. So Megan, I don't know if you can pull it up. I just have some pictures. I think the centering pictures are probably the most fun ones to see.
Let me just pull that up here for you.
Yeah. I went into another great centering story I have is we have this activity where we put cups out, one with a happy face and one with a frowny face next to a word. So exercise, diet, smoking, drugs, family. And then on break, there's this big giant bowl of beads, and they take a handful of beads and they just put them in the things they're doing good and bad at. I don't know. They go up individually. I don't care who did what. And then when break's over, I can kind of look at how the group collectively thinks they're doing in those subjects. Now, each of these group members had one-on-one first OB appointments, so it wasn't like I didn't have a personal chance to meet all of them, and I didn't ask all the health questions. But when I went over there, the drug cup was overflowing, and all I had to do was hold it up, and I held it up, and I'm like, you guys, we don't have to talk about this, or we can, but it's full. I'd let anybody want to say anything. And one person admitted to their addiction problems, then the other, and they all went to rehab groups together, went to at the time it was community mental health in the area, and provided support. So again, I think we need to rethink not only how we provide care, access to care, but community support. And definitely in the postpartum period as well. So this first picture is just one of our groups right before they were getting close to delivery. And then up top is one of my miracle babies. Again, a baby that shouldn't be here today, was born not in good place. Mom actually had an abruption from falling off stairs, but was told to wait in triage for hours because I think the nurses were annoyed with her frequent visits, and it ended up with some pretty bad outcomes for delivery. And thankfully that baby survived and is doing well today. But again, things like that, we really need to look at our implicit bias. We really need to keep drilling into people in the OB and PEDS world, how much our actions and our judgments are affecting the healthcare of others. I don't know, Megan, if there's any more. I think I put, and this is one of my families who also came to me, had 2 babies before they were out of high school, and then wrote me this beautiful letter with a photo album when those babies turned 10. I wasn't even practicing in Muskegon anymore, and it showed up at my doorstep. So again, it's that extra piece of care and touch that we can provide as healthcare providers, community members, doulas, initiatives. MIHP is big. I work with them mainly in DHD-10, but I've worked with them in Muskegon Family Care for years as well. Social work. I mean, every avenue has a piece of this. We all play a piece, even just, a friendly smile and how are you doing today to someone who's pregnant at the grocery store that looks like they're struggling with their other baby might make the difference in the world. So I think when we look at this, it's a very big problem, and we have to, in my opinion, in my role, is to start with who I can train and who I can create space and a heart for, as well as advocating and supporting like Kimberly and the doulas. That's just, I'm so excited about that. So supporting each other in all of our initiatives as we try to help people survive and thrive. And the most important part, in a woman's life usually is her pregnancy and her infant baby growing up. So we can provide a lot of care there. So I've talked long enough. I think there's one more picture and we'll pass the buck. I think this this is another group kind of interacting, listening to each other, sharing their stories. And then my last picture are some of my babies in Haiti that have grown up. So that's a whole different country and a whole different set of issues, but still very much learning and growing from that, those people as well. So I've spoken enough. You guys, the rest of the panel are fantastic women doing really great things. So I'm excited to hear from you.
Awesome. Thanks, Dr. Brown. And I love the pictures that you shared with us too. Those are really touching to see too. I'm gonna move on here to Kelly Olson. So Kelly, again, she is from the Maternal Infant Health Program at Muskegon Family Care. So she's gonna talk with us about her perspective on maternal infant health in Muskegon and how her program is working to improve outcomes in that area. So hi, Kelly, welcome to our event. Oh, I think you still are muted, Kelly.
Oh, hi, everyone.
There you
Can you hear
go.
me now?
Yep.
Okay, sorry. I had everything prepared, and now after hearing you, Bethany, I just want to go off on a tangent about, you got me inspired about a whole different tangent about just meeting people where they're at. But I will start a little bit with what I had prepared, and then maybe I will go on a little tangent. But just starting with, I just started with looking, I'm sure maybe some of you have looked at the governor's plan on advancing healthy births. And if you've looked at that or even heard about that, previously there was a lot of work done on improving maternal infant health equity. And that came with the doula coverage for Medicaid. And so that was huge. Medicaid coverage for moms postpartum through 12 months. So that's a huge one. But now looking through 2024 and 2028, this new plan, there's some 4 key areas. And what I'm going to do is kind of say those 4 areas and then explain my program and how we kind of fit into those 4 areas, because what we do ties directly right into that. But the first statistic that always is just so shocking that it feels like in Michigan, in this country, it's in 2021, 656 infants died before their first birthday. How does that happen in a developed country like this? This is still happening. And then when you get even more specific, that 3 times more likely a Black infant is to die. So there's definite disparities, and there's huge, big reasons. I'm sure the social determinants of health are something you talk about in classes. There's lots of reasons. There's not, like Bethany was talking about, there's not a one size answer. We all have pieces into the puzzle that we can fit to help that, which is why having a wide panelist and programs and all of that, there's definite room for improvement for everyone. And then from 2011 to 2019, 127 women died from pregnancy-related causes. And Black women were 2.8% times more likely to die from those pregnancy-related causes. So something is happening. We're the most developed nation in the world, and yet our moms and babies are still dying. So obviously that has to be addressed. The 4 areas that the state has chosen to focus on are health across the reproductive span, full-term healthy weight for babies, infant safe sleep, and mental and behavioral health and well-being. So enter our program, which is MIHP. So the goal of MIHP is to reduce the rate of maternal and infant morbidity and mortality by promoting healthy pregnancy, positive birth outcomes, and healthy growth and development for infants. So it fits. And this program was started way back in the 1980s. So it's a long-standing program. It's been going on. It was kind of redesigned in 2004. Way back then, it was you had to meet certain criteria to be enrolled in the program. You had to have really high-risk areas in order to be enrolled in the program. And now it's just for anyone who's pregnant on Medicaid or any infant on Medicaid. So it's open for anyone. In 2009, they really made the program evidence-based and standardized across the state. There's about 80 to 100 programs across the state. So what that means is everyone has the same intervention. So it's proven that this program works. Each program has the same setup. And across the state, almost 17,000 families enrolled in the program last year. So that's a pretty good number of families. So each family that enrolls in our program gets a team of a registered nurse and a licensed social worker, and there's also a lactation counselor. So we are a team that surrounds the family. If they enroll right at the beginning of their pregnancy, they get the benefit of having the knowledge of nursing, of social work. Depending on what their needs are, they can get everything from the pregnancy education to breastfeeding information, help with counseling, just whatever this family needs. So the biggest thing is that we're meeting them where they're at. So we're going out to their home, we're talking with them, developing a relationship with them, figuring out what they need. And then giving them that education as well, and figuring out what those barriers are. So maybe they're not going to, so let me get back to those areas. So let's say health across the reproductive lifespan. You know, if they're not going to their prenatal appointments, maybe they don't feel safe there. Maybe they're not comfortable with their provider. Maybe they don't understand why it's important. Maybe they just don't have transportation. Maybe they have childcare problems. Maybe when they got there, they took 2 buses to get there, and they were a few minutes late and they were greeted very rudely, and they feel like it's a horrible place and they're not going. Maybe there's just a lot of other things that are beyond what we're seeing as a provider that are going on. So when we're there in the home, we can talk and figure out, you know, what is that barrier to try to help them be able to access that care and why it may be needed. So we're not missing, or the provider's they're not having to go to the ER because they've missed those checkups, and they have not, and all of a sudden they have preeclampsia because they've missed all those checkups. So that's one thing that we really try to focus on. So full-term healthy weight babies obviously is a big focus. Babies are healthier when they come full term. That is for everyone. It's going to reduce risks for the whole family. You know, when a mom has to be off work, if the baby's in the NICU, there's problems with childcare for the other. It just compounds every issue when babies come early. Breastfeeding is hard to get started. So we really try to focus on that, but that comes with attending appointments and reducing risks and smoking and drug use and all of those things. So everything really is wrapped together. Infant safe sleep is another main focus of ours. We are able to provide pack and plays for our families. That is a big focus of ours. And one advantage of being in the home is we actually can see their sleeping environment. And when I think a lot of people understand safe sleep and they say it in the hospital and people talk about it, but then babies end up sleeping in their swing and babies end up sleeping in the sofa. And so when you're there and you understand and you have a relationship and you're talking, you can approach those subjects a little bit easier and really try to help work out in real life. I know when you get up to feed the baby and you sit on the sofa, so maybe we move the pack and play right here, or let's take out, this looks super cute, but let's take out those stuffed animals in the corner and put them up on the shelf here. The stuff you don't necessarily hear about, but or maybe those are questions when someone shows you their nursery. Those pillows and those blankets are super cute, but we don't want those in with baby. Because safe sleep is totally preventable, and being part of not only this program, but also sitting on child death reviews, just hearing about infants in our community that are passing needlessly, it's horrific. So, I mean, these families will never be the same. So, and the fourth area, mental, behavioral health, and well-being. So that goes and covers not only mental health, which can be postpartum depression, which is very prevalent. I think when we talk to our moms and families, you know, everyone is stressed out. So that stress level, and if you're already very stressed, and you know, a lot of that comes from those social determinants of health. If you have a lot of trauma history, if you're worried about your housing, if you're unemployed, if you've lost your job, you're already going to be stressed. So, and you're adding a new baby, and that's just a big change in your life anyways. So there's a lot of stress going on. In Muskegon County in particular, there's a lot of substance abuse. So that always adds an added complication, tricky to kind of the self-medicating, I think, for people. So a lot of marijuana use. And so helping people navigate that and reducing and balancing that with mental health. A lot of people maybe don't want to seek counseling, but are willing to have, you know, an MSW come to their home and chat with them, but maybe don't want to go to counseling or don't have time or don't want to take their baby or do all that, but they're okay with someone coming to visit. So we provide that option too. So it's really just a full kind of wraparound for the first year, 18 months. That really is a service that I just want it to be normalized for everyone. Um, so if you see a friend, pregnant mom, say MIHP is, give it a chance. I feel like once we get in somebody's door, nobody rarely says we don't want it anymore. Like, it's a great program. So I wish I had it when I had my babies. I would have loved to have a nurse come and weigh my baby and um, do a little developmental screen too, just to make sure baby's on target. So if they're a little bit behind, we connect them with the resources they need before they're 18 months old. But really, we're trying to help mom to try to get these disparities, just trying to curb them a little bit what we can do and hook them up with the other resources that are out there.
Awesome. Thank you, Kelly. And thanks for kind of sharing what your program does. I think it is, yeah, really amazing. I was going to say the same thing. I feel like having that service as a new mom, especially somebody coming into your home and talking with you about those things, and even the things you talked about with like the safe sleep, I feel like that's huge, and that's got to be making a huge difference for these moms who don't otherwise have that service. So I think that's great. So next, I'm going to have Kimberly Sims share with us. So Kimberly, again, if you joined us a little bit late, she is from How You Birth Doula Services in Muskegon. So this is an initiative in Muskegon County. They are working to expand their access to women in the county, especially women of color. So Kimberly, thank you again for being here today, and welcome. Kimberly, I think you're still muted.
Okay, can you hear me okay?
I can, yeah,
All
thanks.
right, awesome. Can you see the slides at all?
Not yet.
Okay, let me try this. My apologies. We had it all set up. See,
No, that's
this
all
is
right.
why I say technology is a beautiful thing when
There.
it works.
Now I see it.
You see it okay now?
Yeah.
Okay, great. Thank you guys so much for the opportunity. I'm sitting here and I'm thinking about my slides and I'm like, doggone it. There's a couple more that I wish I would have added based on the conversation that's going on. It's a lot of good information. So I'm going to jump in because I always like to make sure that I leave room for questions. That's my expertise. I love the question and answer part. But before I start any presentation, I just like to hold space for some Black moms who have died in childbirth. So if you would just bear with me and give just a couple minutes and let me read off some of their names so we can hold a little space for these women, because it's because of their sacrifice and their loss that some of these conversations are being had. Christine Fields is a mom, Tori Bory, Dr. Shalon Irving, and Samani Gibson. Those are a few of the names that are recognized in a national scene. Yeah. Thank you for that. I just always like to take a special moment and just hold space for those women. So again, my name is Kimberly Sims. I'm with the How You Birth Doula Initiative. We're here in Muskegon County. We're actually starting to creep a little bit into Kent County. We've gotten some calls for some services over there. And so we go over there. And so just quickly, a little bit about me. I am both a birth and postpartum doula. I'm a childbirth educator. I'm also the owner and operator of my own doula services, Just Be Doula Services. And then I've been married for 27 years. I keep having to remind myself that. 27 years, I have 3 children ranging in the ages from 34 to 15. And I'm a huge community advocate. I love Muskegon County. I love everything about Muskegon County. We have some challenges, but I appreciate the people that we are to band together and rise to correct and fix some of those problems. And so that's kind of how You Birth came into being, right? It came from a group of people got together in 2020, looking at understanding racial healing. And they began to look at the health disparities within our community. And they landed on the fact that the infant mortality rate and the maternal death rate in our community was something that they wanted to be able to focus on. They determined that doulas was a way in which they could team together to focus on those issues. And at the time, they realized that there were only maybe 2 or 3 doulas in the community that they knew of, and I was one that they knew how to get in touch with. So we came together, we started the conversation, and in April, we trained our first set of doulas to be able to serve our community. So this is just a list of some of the organizations that have partnered with us to make this program happen. These are some of the statistics that we looked at. And so in Michigan, the births that are less than adequate, they have less than adequate prenatal care is 32.2 in Michigan, but in Muskegon County is 36.6. And in the US, Black women are 3 times more likely to die from pregnancy complications. Right. And so I'll just kind of leave some of those stats there for you to take a look at if you like. This presentation I can get out. I can get you guys this if you want to see it. This is just some of the stats that we work from daily. This is one of the most important pieces for me because this centers why we do the work that we do. This is Kanisha. Kanisha is now a part of our executive team. And Kanisha, this is Kanisha's story. So during the pregnancy with her second child, she experienced very bad swelling toward the end of her pregnancy. It was confirmed that there was small amounts of protein in her urine, but it didn't induce any treatments or anything for preeclampsia. 9 days after she gave birth to her daughter, she returned to the hospital with a major headache. They were going to take her down for an MRI. And in the process, going in the elevator, she actually had a seizure. And they had to put her into a medically induced coma. That was on Monday, January 15th. She woke up on Wednesday, January 17th, to learn what had happened. Her thing has always been, I'm not blaming any doctors. I don't ever want to pass blame. Things happen, I understand. But I feel like if they would have gone further, I might have been spared that trauma. And my children might have been spared that issue. So during her first pregnancy, she gained 60 pounds, which she says is not normal. And in the first week in pregnancy, she developed Bell palsy. So all these were kind of signs that something was going on deeper that could have been looked at, but were not. So Kanisha feels that having a doula at her time would have been very beneficial to help guide her through some of these most difficult times. When she had her first baby, she developed postpartum depression that never was treated and was overlooked. Paired with the Bell palsy and the other things that she acknowledges that it kind of takes a toll on her. Her thing is she wants to make sure that no woman is ever denied a doula. So we work very hard on behalf of moms like Kanisha. She always reminds us and centers us back to why we're doing what we're doing. We just have to look across the table and to be able to stay focused. And we appreciate Kanisha for that. So this is kind of some overviews of what the progress that we've made thus far. We're trucking right along. We laugh about it. So our first baby to the cohort was born on June 30th. Our doulas were completely trained as of May 1st. We had our first baby on June 30th. Then we are actually excited. We've done a lot of work here with Trinity Health to overcome some of the barriers. Doulas aren't always welcome into spaces. And so we've worked very, very hard to try to make sure that we can be accepted in those spaces. We have a very, very good relationship with our docs and our nurses especially. We've even had a training with the nurses where we actually trained with them like for a couple days on some different techniques. And so they actually enjoy when we're there. So we have a very good relationship and I'm excited about that. We've now trained 15 postpartum doulas. because that is a huge piece in the birth process, right? We don't ever think about many times the fourth trimester, but the fourth trimester is hard. That's when mom and baby go home. A lot of things happen that no one kind of has their eye on if they're not a part of the MIHP program. And so this is a really strong point for me. We had to get postpartum doulas in, so we've done that. As a result of us starting to stretch out a little bit into the Kent County area, we've started to tour some of the hospitals over there to become more familiar with their practices and with their staff. And that's been really good as well. And then on December 26th of 2023 was when our last baby was born. So to date, we have birthed 17 babies, I believe, and we have like 3 in the oven so far. So these are just some of the presentations and things that we've done. We have our second birth doula training coming up in July. We're going to host a grief doula training, so then our doulas will become full spectrum. And one of the things that sets our program apart from many others, I think, is the fact that we meet monthly. Our doulas, we meet monthly as a cohort to kind of do some extra training on some things, talk through births that may have happened, and really to be there as support for one another. All of our doulas are donors trained. And that's one of the things that we found to be very important. DONA tends to be at the table anytime birth is going to be discussed or talked about. And so we just felt like DONA was a good training to be a part of. Not that the other programs aren't good. This is just the one that we've chosen for now that works with us. So this is a slide that shows, so we've had 16 babies to date. We just had a baby last night, so I didn't update this slide. My apologies. We've had 14 natural. It would be 15 now. 1 scheduled C-section. We had 1 emergency C-section because she developed preeclampsia. 12 doulas have served these, so it's been 12 different doulas that we've been able to rotate because our goal is to make sure that they have their 3 certifying births. And so when they leave the cohort, they all can be donor certified. And then we have 3 buns in the oven. That should be 5 now because I just signed 2 new ones today. We get our referrals from programs like MIHP, Hackley Community Care. We have the doctors and the OB offices now sending us referrals. So right now I'm excited to say I get anywhere between 2 and 5 referrals per day. That's where we're tracking right now, just since the first of the year. So things are really picking up for us and we're excited about it. We just got to get enough doulas on board to be able to service the families. So far, we have 4 families that we are working with in postpartum leave. So this is some of our literature. I don't know why I felt the need to put that on there for you, but I did. So this is some of our literature. So doctor's offices, programs, they send us a referral form that you see. I get the information, I reach out, and we have an initial appointment with the people. So that's the end of my presentation. I want to throw out there a couple of documentaries or resources that may be good for you all to watch. Would be Aftershock. I don't know if many of you have seen that. It actually is streaming on Hulu right now, I believe. And then the next one would be Birthing Justice. It's a PBS documentary that has been really good. And based on some of the conversation that was going on, there's a book out and it's called Weathering. I would really suggest if you all haven't read any of that book to skim through it, and it just talks about the effects of racism on the Black bodies and what the effects of some of that can be. And I strongly believe that some of the outcomes that we're seeing right now, especially with moms and that rate, is a result of weathering, what's called weathering. So I encourage you all, if you're interested in the program and you want more information, take a picture of that QR code, and that takes you directly to all of our information to get you anything you need. Thank you so much for having me, and I look forward to any questions that you guys may have.
Awesome. Thank you, Kimberly. And I was just going to point out too, so Dr. Brown's students in OB right now, they're going to be at Trinity and Muskegon for their OB rotations this semester. So it would be really cool if they got a chance to work with any of your doulas while they were there too. So awesome. Very cool. So finally, our last speaker today is going to be Patrice Beaubier. So Patrice, again, she's a licensed midwife and she's the owner of Full Circle Midwifery in Oceana County. So Patrice, we're really excited to hear your perspective on this topic as well. And then we should have time for a couple questions at the end. If you guys have any more questions, I see at least one here in the chat box at the bottom. If you have more, you can start to enter those now right down there in the Q&A at the bottom of your screen. With that, I'll open it up to you, Patrice. Oh, I think you are still on mute too.
Okay.
There you
A
go.
little bit about me. I'm a licensed midwife and I'm providing maternity care in West Michigan for women planning home births. I attended my first home birth in 1977 and soon after that knew I'd found my calling. So I searched out midwives that I could train with and apprenticed with them for 3.5 years. My practice is Full Circle Midwifery and it started in 1982. I practiced for 36 years without a license, and finally, after 10 years of a lot of hard work in Lansing, we got a licensure bill passed in 2017. I'm on the board of licensed midwives for Michigan, as is Kimberly Sins. There are now 94 midwives licensed in Michigan. I really love what I do. I've attended over 1,900 births, most at home, although we're not anti-medical and we're quick to move into the hospital setting if that seems safer for the mama and baby. I have attended many second-generation births. I've attended as many as 11 births for the same woman. I'm 72 years old and I still attend about 50 births a year, but I'm trying to slow down a little. Some other things that are important to me are supporting birth centers that are working with women of color. I support Birth Detroit out of Detroit. They're doing great work there. They have their grand opening and gala in May of this year. I also support Grace Birth Center in Haiti, which is working with Haitian women, underprivileged. We've brought the director of that birth center into Michigan many times. We helped her get trained, and the birth center is up and running, and they've done as many as 3 births in a day now. They're doing great work. In my own practice, most of my clients are white. It's really not as diverse as I would like. Many of my clients are from privileged backgrounds and they kind of self-select to have home births. I also have worked with the Amish and a lot of other conservative Christian groups. I used to work more with low-income people, but Medicaid in Michigan now pays for about 50% of the births that happen in this state. And there are a lot of families who might prefer a home birth who have just gone with a hospital birth because there's no money out of pocket for them. Many healthcare providers choose home births. That's really interesting to me. Many women who've had an unsatisfactory first birth in the hospital come to us looking for a different kind of experience with their subsequent births. We usually work in teams of 3. We usually have some of us on call 24/7, so we are available for our clients if anything comes up. I'm happy to say we are getting more women of color coming to us for home births, and especially as the disparities become more widely known. Licensed midwives in Michigan are required to take courses in implicit bias, cultural awareness, and disparities in order to be initially licensed and also to renew their licenses. I'm a preceptor for 5 midwifery schools, and they all require the preceptors and the students to take these courses. I think it's been a huge blessing for more awareness. I consider myself a well-read, well-traveled, broad-minded, liberal woman, but I have to continually check myself for biases. I think we all need to be more mindful and aware of how we approach those who are different from us. especially healthcare practitioners. I think we need to be really clear at addressing our own biases so that we can be with women and truly hear and see them in their own surroundings. I think the state of Michigan is doing a much better job of addressing health disparities. The conferences they've been having in Lansing the past few years have been excellent. Just a little bit about the way that midwives are working to address disparities and improve access to respectful care. There is a longtime midwife practicing in Florida, Jenny Joseph, and she has easy access clinics where anyone is able to just walk in and get a prenatal visit. I know sometimes I have women call me and tell me that that they have to wait 5 weeks to get in for a prenatal. We really hope to have an easy access, more easy access clinics available to families. I tell anybody who calls me and can't get in that they can just come right over to my house and I'll check things out for them, whether they choose to set up an initial visit with me or not. I think midwives, all midwives are really good at mindfully listening to women. I think if we there's a way to have people talk at you when your mind is really elsewhere. And I think it's so important that we truly pay attention to what we are being told by the women who are in front of us or with us on the phone or texting us or emailing us. Midwives provide a lot of education during the pregnancy. One of my big things is nutrition. I have an organic farm and I'm just always sharing food information, how to eat better, how to not base your diet on processed foods. I know access to good foods can be a problem in some parts of Michigan, and you know we've got to keep working toward making better access for good foods. One of my favorite books on nutrition is called Real Food for Pregnancy. It's an excellent resource, and we have about 6 copies in the library here that we loan out to people. We do a lot of education on comfort measures, natural comfort measures in pregnancy, getting good sleep, getting good exercise, having a healthy home. We refer to other health professionals we trust if women have a need. We listen to women. We have almost 100% successful breastfeeding moms. We really promote the first 1,000 days, which for those of you who aren't familiar, it's a great training program online, good resources for getting the right nutrition during pregnancy, while breastfeeding, and for the first 2 years of a baby's life. It's been shown to have a lifelong effect on a person's good health. We provide in-home care. A lot of midwives provide prenatals in the home. I personally don't. I have an office and I'm too busy of a schedule to go to everybody's house for all their prenatals. But we do provide in-home care for postpartum visits. We go back to the woman's home on day 1 and day 3 after they've had a baby. We also see women in the office at 2 weeks and at 6 weeks. Plus they, as I said, have access to us 24/7 after the baby is born. We listen to women. We listen to what they tell us during visits in the office, visits in their home, and the contact we have with them. There's really a push in with midwives to train more midwives of color. And that's been going on with most schools and also our national organizations for about the past 6 to 8 years. I think every mother deserves a care provider who she can personally relate to. I think it's important that pregnant women are treated as if they are special because they are. I think growing another human being is growing my future, your future. Raising healthy children is the hardest thing that we do, and it's so important for our culture. a barrier, I think, is for my home office, most families drive at least a half an hour to an hour to get to a midwife. We're working really hard to get more midwives doing home births trained in Michigan. But the distance, especially in northern Michigan where there are so few providers, and in the UP, it's just, it's horrible how far people have to go for good care. I am part of a group opening a new birth center in Muskegon that we hope will make access in that city area that will make access more available to families in that area. It's closer to a larger population on bus routes, just easier to get transportation. We also have started a nonprofit with that birth center that will subsidize low-income women who come there for care. The birth center is also planning on having moms groups for during the pregnancy and also for postpartum times. They'll have breastfeeding support available. They also plan to use doulas at the births and have doulas trained through that birth center. And we really hope to open a midwifery school in Michigan in the future. Right now, the licensed midwives are all going to schools outside of Michigan. And that's all I have to say, and I'm very interested to hear if we have any questions.
Very good. Thanks, Patrice. So I do have at least one question down here in the bottom, so I'll pull it up in a second. Well, while I do that, I just want to say, as somebody coming from not the OB or not the mother baby side of nursing, it's been very impressive to me to hear all of you guys share what you do in your programs and also how they all kind of work together and how everyone has the same goals to support moms and to try to break some of these barriers and take care of moms and babies. Even though you guys kind of all do a little bit of a different thing, everybody really is working toward the same goal. So I just have found that to be really impressive and meaningful through this. So let me pull up the question that we do have here. So this one is for Kelly. So Kelly, I have a student asking, sounds like she is interested in what you guys do at MIHP. So she says if she was interested in working for MIHP, how would she go about applying for that? Would it be looking for like a job posting on the website or contacting somebody?
It's a great position. We currently don't have any openings. A lot of our RNs actually come here and stay for a long time. They don't leave. They love it. So I'd keep looking. I mean, you can always send an application and we can hold on to it, but right now we don't have any openings. So people like this job and tend to stay.
And I wonder too, you said there are more programs throughout the state. I wonder if there could be openings like in other areas too.
It's certainly possible. There's one other one in Muskegon County. I don't believe they have any openings, but you could check their website. But yeah, there's Ottawa County. There's there's pretty much one in every county. If you go to the MIHP website, you can actually look and tap and see where every program is located. Michigan.gov/MIHP.
Perfect. Thank you. My other question, and this really I think is for Dr. Brown mostly, or anyone can answer this really, but I was just thinking for the nursing students, because I know we have a lot of nursing students who are on today, those who are really interested in this area of healthcare and nursing and who are really passionate about some of the disparities that we've been talking about. What would you encourage them to do now as a student, or steps that they could take to get more involved now or to start thinking about now?
So, there's a lot of opportunity. I started when I was in college in my sophomore year and became a doula through DONA. I had to travel to Cincinnati to do that at the time, but that helped propel my passion for what I was maybe interested in at the time. So definitely there is opportunities for becoming a doula. There's opportunities to read these books and watch these films that we're talking about. I will definitely in my class be recommending a few of them, but just really kind of dive into it. Look deeper. When you think you know the answer, look a little deeper, because or have conversations with some of these wonderful panelists or community members who are already doing the work, because no one's going to know better than the people who are knee deep in it. So I think most of us respond to emails or, you know, really passionate people wanting to know what we do and how they can help.
Right, great, thank you. So something else too, I was kind of thinking about, and for some of the students who are on here who may not really know, what's the difference really between a midwife and a doula? What do they do that it's different at the
Well, there's
patient?
different levels of midwifery. So I'm a nurse midwife. So I had 8 years of college training and got certified through that area. There's Patrice, who's a certified nurse midwife who goes through a different program, just not necessarily a college degree program, but it is a very prestigious and accredited program, also licensed. And then there's lay midwives who don't have, we see those more like when we go to Haiti, you know, a grandma teaching a daughter because they're the only people in the mountain who can to deliver babies there. And then a doula it originated with just labor support. It's very core. When it started, we were trained to provide that piece of labor support because as a labor and delivery nurse, you're spending a lot of your time charting, passing meds. You don't get to just always sit, which is why I loved when we brought midwifery services to Muskegon, because we would always have one of us midwives on call in the hospital, and all we did was stay there and sit with our patients while they were laboring all day. But the doulas are trained. They meet with the women. Some have an office, some go to their house. You know, I should let Kim speak on this, not myself. I'm sorry, Kim. But they provide comfort services, postpartum service, grieving services. They really get more time to intimately know the family. Kim, do you want to add anything? I'm sorry.
Oh, no, you're fine. We always like to say around our group, because we get that question all the time, doulas coach, midwives catch. So we're there strictly as support, right? And the midwives are the more who on the medical side. They listen to baby's heart tones, they assess positions, they do all the other stuff. And so I like to tell people all the time, doulas are like your best friend, but we've got some birth knowledge. We can help get you through the process a little comfortable, right? And so that's the way I always like to break it out. Yeah.
Great. Let's see, it is 4:04 right now, and I don't have any other questions, so I think I am gonna wrap this up, and let you guys get off of here, unless anyone has anything else they want to share. Otherwise, just a couple things for me to share as I conclude. So I just really want to mention that we have a few more Humankind events that are coming up this semester. So you can see a full listing of those by going to the West Shore Community College Humankind website. And once you've gone to the website, you can choose Humankind under the community drop-down menu. And then also, if you are one of the audience members on the Zoom today, as you leave, you're going to be asked to complete a survey. And that's going to let you comment on the quality of this presentation and give us some feedback. And this is really helpful for us here at the college. So just let us know what you liked about the presentation and any opportunities that we could implement to improve the viewer experience for this as well. So I just want to say thank you again to everybody for joining us today in the audience and all of you guys as panelists. I would just say the next time I have a baby, I want all of you guys there as my team to help me through it. So thank you again to everybody, and I hope that you guys all take care and have a good night.
Thank you.
Thank you very much.
Thank you.
And